The most common risk adjustment diagnoses documented without support in patient's medical record. Lesson objective. Healthcare providers will learn about diagnoses that are most often not supported by their peers' documentation to ensure that these diagnoses will be validated when documented in their own notes. In this module, we will cover the following topics. Provider data validation or PDV. Risk adjustment diagnoses most often documented without support, and how to make them valid in the documentation. Peripheral arterial disease or PAD. Diabetic peripheral neuropathy. Diabetic autonomic neuropathy. Atherosclerosis of aorta. Type 2 diabetes mellitus with hyperglycemia. Acute myocardial infarction. Acute cerebrovascular accident or stroke. Angina pectoris. Malignant neoplasm or cancer. Primary hypercoagulable state. Secondary hypercoagulable state. Substance use disorder. Seizure versus epilepsy. Provider data validation. It is a chart review performed by an auditor from the Medicare Advantage organization to confirm there was documentation in the patient's medical record to support the diagnoses submitted. The review validates the accuracy and completeness of the diagnosis code submitted on the claims. Since the purpose of the provider data validation audit is to verify whether medical records accurately support the data submitted, healthcare providers submitting risk adjustment data must ensure the accuracy and integrity of the submitted risk adjustment data. The final step of the provider data validation audit is to educate healthcare providers on how to improve areas that were not validated during the chart review. Medical records report the care a patient received in chronological order and record pertinent findings and observations about the patient's health history. Medical record documentation helps physicians and other healthcare professionals evaluate and plan the patient's immediate treatment and monitor the patient's healthcare over time. Accurate diagnosis code assignment is dependent on the healthcare providers clearly describing each medical diagnosis to the higher level of specificity. The health record must reflect a physician's intent and clinical thought process documented in a manner that supports each risk adjustment diagnosis code. Let's see the most common risk adjustment diagnoses not supported.